In April, the second wave of coronavirus ravaged India. Close to 1.5 lakh deaths took place starting from the second week of February, and it's believed that the deadly Delta variant was behind the tragedy that unfolded, but now there is another reason to worry. Health officials are concerned over the mutated version of the Delta variant called Delta Plus. Over 40 cases of Delta Plus have now been reported in India, and the centre has advised 3 states, Maharashtra, Kerala and Madhya Pradesh, to exercise utmost caution. The centre asserted that public health response has to be more focused and stringent. So the question is, with many predicting that a third wave is round the corner, is Delta Plus pushing us towards the third wave?
You're watching the News Hour at 10, debate number 2 on Times Now, Super Prime Time.
Dr. Dilip Malvankar, Director of Indian Institute of Public Health in Gandhinagar and Member Secretary of the Gujarat State COVID Task Force, is with us. And my first question is Dr. Shashankar Joshi, member of the Maharashtra COVID Task Force. Dr. Joshi, 4 days ago, I read a report about how a committee of you are a member has also predicted that the third wave could be now imminent. Is there a connection between Delta Plus and the third wave, considering that maximum cases of Delta Plus are also now being reported from Maharashtra?
Padmaja, there is no connection between the two. The third wave, if and when it comes, it will come fundamentally because of 3 reasons. Number 1 is total lack of adherence to COVID appropriate protocols, lack of adherence to COVID appropriate behavior, and lack of vaccination in geographies. So we need to saturate our districts and geographies of concern with 70% vaccination ASAP in the next 3 months. It is likely predicted that between September and December you will get it. But the rate at which the lack of adherence to protocols and behavior is happening, it could get hastened. Normally in United Kingdom, the gap between second and third wave was 8 weeks, and that could get shorter. We are still not out of the second wave, but just if you see the numbers in Mumbai today are up, the numbers from 6,000 in Maharashtra per day are up to 10,000. So we can see that the unlocking or the partial unlocking is seeing some things. The so-called Delta Plus variant, actually predominant cases are reported from Maharashtra because there was a joint project we started between the Institute of Genomics and Integrative Biology of Delhi and Government of Maharashtra with an MOU. I'm also a part of that project. And every district of Maharashtra, just like they had done in Kerala, 36 districts, every week from April, May, they had analyzed 100 samples each. And from those genomic sampling, some samples in the district of Ratnagiri were found predominantly to have an AY1, which is called as a Delta Plus. Right now, the data is too small to make any comment. Maybe it's a little more transmissible, but that data and granularity is not out. Most people, this data is probably 2 to 4 weeks old, and probably this data which has emerged, most people are mild to moderate. So one thing is clear-cut, Padmaja ji, that Delta Plus is a cause of concern, but not to panic. But we cannot let our guard down at all. The mistake we made between the first and the second wave, we can't repeat to ensure that we just need to focus on vaccination and COVID appropriate protocols and behavior to have it in place. Because even if there's a variant of concern, which may admit may be a more transmissible one, our public health strategy has to be very sustained and containing. Micro containment of that geography has already been done, and we need to be very focused in our public health approach of aggressive testing, COVID appropriate behavior, zero crowding situations, no congregations to be allowed.
Dr. Malvankar, how is the Delta Plus different from Delta? How is it going to manifest itself, and what are its going to be? What are its effects going to be?
Yeah. So Padmaja, this is a new sub-variant found, and we have to wait till more studies are done. But as Dr. Joshi said, the clinical picture of these reported 40 cases is still very mild type of disease and not very aggressive. Of course, we also have to do laboratory experiments and see whether in the laboratory the virus is spreading very fast as compared to other mutants. It's also reported from some laboratory experiments that it has more affinity to the pulmonary alveolar tissues, and that may indicate, like Delta, it may invade the lungs faster. But all of this is, as of now, conjectural, and we need more and more data, not only from the places where it is identified, but also from other geographies where testing may not be and sequencing may not be that much. So we need to do more sequencing. Second is, most of our data denominator is missing. For example, in Ratnagiri, how many samples were tested, of which how many were positive? Because if 6 were tested and 6 were positive, that is 100% in that district. But if there were 600 tested and 6 were positive, then it is only 1%. So just saying that 20 are positive, but from each location. The other concerning factor is that it is reported from 3 different non-contiguous states and different districts. So maybe it is evolving in a different place, because one cannot imagine that somebody traveled from Kerala to Madhya Pradesh to Maharashtra and spread the disease. Possible, but it may be evolving differently. And that also Maharashtra districts, if you see Madhya Pradesh districts, they are non-contiguous districts. So the epidemiology of the disease, its genomics as well as the clinical picture have to be correlated along with the laboratory studies. And
Dr.
more
Joshi,
such
can you fill in that
sequencing.
blank? How many samples were tested and what percentage turned out positive? What Dr. Mavlankar is referring to?
Yes, it was only 6%, so that's a very reassuring thing. And what we have done is another large sample size has also been collected in subsequent weeks, of which data will be available from IGIB, Dr. Anurag Agarwal's lab, in another week or 10 days. And that would be very crucial, because remember, we did sequential testing, 100 samples every week from end of April till June now. So every week 100 samples were analyzed. And this is probably a large proportion which was tested. So percentage is still very, very small. And which is why, as I said, this could appear like a delta minus based on the anecdotal reports which we are seeing. But what Dr. Malvankar said is, because there are non-contagious geographies and the AY1 is seen in UK, it's seen in Nepal, and also is seen in India, there was one concern which we expressed from Ratnagiri. You know that Ratnagiri is popular for mangoes, and when the mangoes are removed, usually in the month of March, April and May, people from Nepal come and remove the mangoes. That's one possibility which was raised then. But later on this was investigated, and now also we have data from genomic scientists which have discounted the fact that this has any connection with the Nepal variant, because the Nepal genomic surveillance is also done by IGIB, and they have clearly discounted that strain from there is not linked to the strain which is observed in Ratnagiri. But as Dr. Malvankar said, the data is too small for us to make any conclusive remarks. And a large population or a large number of genomic samples have gone in from a genomic standpoint. See, remember, genomic sampling cannot be in thousands because these are expensive and sophisticated labs. We need to expand that. Now, one thing which happened in the second wave because of the geometric proportion is that the 5% cut point from INSAGOG was removed. And I feel it is time that Government of India increases the genomic surveillance now back to the 5% again. And we need to do aggressive genomic surveillance. We need to do zero surveys, better clinico-genomic correlation. And probably in the next 6 weeks, we'll have much better answers to see the trajectory where this will move. As of now, we have early indicators to suggest that it may not be as sinister as it has been propagated, except that whatever data is outside available outside India, antibody may not be responding, and there may be
is there cause of worry? I'm sorry, I want to ask a follow-up question, Dr. Joshi. Is it cause of worry because today you had 10,066 new COVID cases in last 24 hours, and this is already 1,500 higher than what you saw on Tuesday?
That's an absolute cause of worry.
What do you make of this trend?
So that is completely linked to lack of COVID-appropriate behavior, not following COVID-appropriate regimens, crowding. So that is not linked to the variant of concern. And if we have a variant of concern, it will propel it further. So I think currently the second wave Delta is very much prevalent, and we cannot afford any complacency. There is a jump of almost 4,000 cases. It's a huge cause of concern. It's a grim situation. As we are vaccinating the population, we definitely are worried, and we definitely need to do mindful unlocking. And if needed, we may have to relock some places if there is lack of adherence to COVID appropriate behavioral protocols.
Okay, so If you decide to not follow COVID appropriate behavior, I think the number and the observations of the doctors are quite clear. Partial unlocking may start all over again. Don't call this upon yourself. Thanks very much, Dr. Mavlankar and Dr. Joshi, for having joined us. This is an ongoing conversation. We'll keep a close eye on the numbers as well as the virus. Thanks for watching.
The News Hour at 10 will be right back after the break.